everyone. Today we have one nomination, 6 bills on the agenda. Patrick Davis, who's been nominated to be Assistant Attorney General, is on the agenda for the first time, so he will be held over. The 6 bills on the agenda are ripe for consideration. Today's markup is about addressing the high cost of prescription drugs and abusive practices that keep prices high for too many American families. These bills are not new. In fact, we voted them out of committee February 2023. But we're back here today since the leader of the Senate refused to bring them up in the Senate last year. So we're taking another shot at making sure consumers aren't being taken advantage of by anti-competitive practices, which then stop cheaper generics from reaching the market in a timely fashion. It's time to make the system work better for people who need it most, the patients and consumers who can't afford to keep paying sky-high prices for their prescription drugs. The bills that we're discussing today are designed to directly tackle these issues. Among other things, we want to end pay for delay deals. Right now, some brand name drug manufacturers pay generic companies to keep cheaper options off the market. That should have stopped a long time ago. We're at it again. We also want to fix abusive patent practices and strengthen agency collaboration. Not only do we want to encourage agencies such as the USPTO and the FDA to coordinate better on patents, we want to prevent companies from gaming the system through product hopping and patent thickets. Further, we want to curb the use of sham citizen petitions. This will make it easier for generics to obtain approval, get on the market quicker, thus lowering costs for everyone. Finally, we want to commit the FTC to finish work that has started in studying the impact of PBMs on competition. Understanding the PBM industry and collecting data will shore up marketplace transparency and help us address concerns about abusive PBM practices. These bills won't just level the playing field for smaller companies, they'll help make prescription drugs more affordable for the people who need them. At the end of the day, this is all about people that we represent. For too long, consumers have been at the mercy of drug companies that can keep prices high by blocking competition and abusing the system. The bills that we're looking to take up today will be a good step at changing that. It will be a win for families, for taxpayers, and for anyone who believes that competition leads to better prices. I'm looking forward to working with everyone on these bills. Now, a procedural commentary, not of this committee, but a procedural commentary about the United States Senate and prescription drug bills. I've spoken about how these bills have been on this committee's agenda before and voted out probably in a non-controversial way or almost a consensus way. These bills have never been brought up on the Senate floor. If they have, they didn't get to be law. Secondly, we have pharmacy benefit manager legislation, not out of this committee, except for the one I spoke about that's an FTC study, but out of 3 other committees in the United States Senate, and in the last Congress, at least one bill out of the House committee. Now, these bills aren't exactly the same out of these three committees in the Senate, but they try to accomplish the same thing of making PBM's operation in the pricing of our drugs more transparent, hopefully transparency driving down the cost of prescription drugs. Now, they collectively have about 65 or 70 senators co-sponsoring it. And now that goes back 2 years. Now, all three of these bills have not been introduced yet in this Congress, but the Cantwell-Grassley bill out of Commerce has been reintroduced. And I can't understand why, when we hear from all of our constituents at our town meetings or in the email or in the phone calls about people wanting us to take legislation up that will get prescription drug prices down, doesn't seem to come up in the United States Senate, and everybody is concerned about the issue. Now, I think there's part of a problem is that through the last 4 years, and maybe it's even going to consider in these 2 years, the Senate's only meeting about 2.5 days a week. Now, this week is an exception because we got to take up the budget. But what's wrong with the Senate meeting 5 days a week so we can get some of this legislation and be more than just a confirming body for members of the executive branch of government? And I think we all ought to think about how much we hear about our constituents complaining about prescription drugs, and we have bills with 2/3 of the Senate being sponsors of solving that problem. We can't get this done. When I came to the United States Senate, we used to start at 10 on Monday and go to 4 on Friday. Now we start at 5:30 on Monday, work Tuesday, Wednesday, and if this was a normal Thursday, but I explained it's not because we're taking the budget out. But most Thursdays, this Senate stops at 2 in the afternoon on Thursday. And there's enough work for senators to work 7 days a week if they want to on an individual basis. But we can't solve this country's problems if we don't get together more than 2.5 days a week to get business done. So I hope somebody will take what I said to heart, and if they do, something might get done, and if you don't, we'll continue working 2.5 days a week. Senator Burbank.